Have you ever wondered if all the medical tests your doctor orders are really keeping you safe? After turning 70, most seniors are told to schedule more checkups, more scans, and more routine procedures than ever before. The message is clear. Testing equals prevention. Prevention equals safety. It feels responsible. It feels like the only way to stay one step ahead of disease. But what if I told you that some of these very tests, the ones promoted as lifesavers, could actually harm you more than they help? Every year, millions of older adults walk into clinics for exams that sound harmless. But instead of peace of mind, many walk out with new worries, stronger medications, or even procedures that create long-term damage. In fact, recent studies reveal that up to 37% of medical tests given to seniors lead to unnecessary treatments, complications, or permanent side effects. And here's the shocking part. Almost 99% of people over 70 have no idea they're being overtested. The consequences? They aren't small. These routine exams can trigger bleeding, kidney damage from contrast dyes, memory problems from sedation, and infections from invasive follow-ups. One of the tests on our list today is even estimated to be responsible for 5% of all cancers in the United States. That's the same cancer risk as drinking alcohol every single day. You won't see that warning on a poster at your clinic. You won't hear it during your annual checkup. But the truth is buried in the science. And today, we're bringing it to light. Because here's the reality. Medicine is powerful, but it's not perfect. And after 70, prevention looks different. Not every test adds years to your life. Sometimes it quietly takes them away. Think about it. You go in for what seems like a standard test. The result shows a finding. Maybe it's a shadow on a scan, a mild abnormality, or a slightly lower number. Suddenly, that harmless checkup leads to more appointments, a prescription, maybe even surgery. But here's the twist. Many of those findings are nothing more than natural changes of aging. They weren't going to harm you, but now they've triggered a chain of treatments with risks of their own. And this is where seniors often lose the most, not from the disease itself, but from the fear, side effects, and complications created by overtesting. That's why in this video, we're uncovering the 5 medical tests seniors should rethink after 70 and the shocking side effects that come with them. We'll dive into the science, share real patient stories, and reveal safer alternatives that protect your health without stealing your independence. But before we begin, I want to hear from you. Where are you watching from? How old are you? And tell us in the comments, have you ever regretted a test or procedure you went through? We're reading and replying to every single comment with personalized tips and advice. And if you find videos like this helpful, don't forget to hit the like button and subscribe for more science-backed senior health advice that you won't hear anywhere else. Now let's get started. The first test on our list sounds quick, painless, and completely harmless. But for many seniors, it leads to fear, harsh medications, and side effects that can quietly ruin your quality of life. Number 5, bone density scan, DEXA scan. It sounds completely harmless. No needles, no blood, no surgery. Just a quick scan, a few minutes lying still, and you walk away with a number that supposedly tells you how strong your bones are. For millions of seniors, the DEXA scan, short for dual energy X-ray absorptiometry, has become a routine part of aging. Doctors recommend it to check for osteoporosis, the condition where bones become thinner and more fragile. At first glance, it feels like a no-brainer. Why wouldn't you want to know if your bones are weak? But here's the truth you almost never hear. After age 70, the bone density scan often creates more fear than benefit. Here's why. Bone loss is a natural part of aging. Just like wrinkles or gray hair, your bones naturally get thinner over time. By the time you're 70, almost everyone will show lower density on a scan. But does that always mean you're at serious risk of a fracture? Not necessarily, yet the scan rarely makes that distinction. The machine doesn't care if your bones are naturally aging or truly in danger. It spits out a score. And when that score reads osteopenia or osteoporosis, doctors often reach for the prescription pad. And that's when the problems begin. The most common drugs prescribed after a DEXA scan are called bisphosphonates. On paper, they're designed to strengthen bones and prevent fractures. But in reality, they come with a long list of dangerous side effects. We're talking about jaw necrosis, where the jawbone literally begins to die, severe acid reflux and painful irritation of the esophagus, odd brittle fractures that happen in unusual places, sometimes just from walking across the room. For some seniors, these medications end up causing more pain, fear, and disability than the fractures they were meant to prevent. Let me give you a real example. Rose, a 76-year-old retired piano teacher, went in for her annual checkup. She felt fine. She walked every day, had never fallen, and had no pain. Her doctor suggested a bone density scan just to be safe. The results came back showing mild osteopenia, which is simply a slight thinning of the bones, extremely common at her age. But her doctor didn't explain that. Instead, he immediately prescribed a bisphosphonate. Within 3 months, Rose's health had taken a dramatic turn. She developed severe acid reflux that kept her up at night, pain in her jaw so intense she couldn't enjoy meals, and she stopped playing piano altogether, something she had loved all her life. The irony: studies show that treating mild bone loss with these medications makes little to no difference in actual fracture rates for women over 70. In fact, one major study found that bisphosphonates reduce fracture risk by only 0.3% over 5 years. That's almost nothing, especially compared to the suffering caused by side effects. So what works better than medication? Surprisingly, the answer is lifestyle. Weight-bearing exercises like walking, climbing stairs, or even simple resistance band routines help strengthen both bones and muscles. Proper nutrition, especially calcium, vitamin D, and protein, gives the body what it needs to keep bones strong. And perhaps most importantly, focusing on balance and fall prevention dramatically reduces fracture risk. Things like removing home hazards, improving lighting, wearing supportive shoes, and practicing balance exercises. Rose made that switch. She stopped the medication, began light strength training, added sardines, leafy greens, and daily vitamin D to her meals. A year later, not only was she free of side effects, but her balance was stronger, her legs steadier, and she was back to performing piano recitals with full energy. And this is the key message for seniors. A scan that looks harmless can create a diagnosis without a danger, a prescription without a benefit, and a cascade of side effects that quietly rob you of your quality of life. So before you agree to a bone density scan after 70, ask your doctor, what will we do with the results? Will it actually change how we treat me? Are there safer ways to protect my bones? Because sometimes the best answer isn't another test. It's a stronger body built naturally. Now, if a harmless scan like this can trigger unnecessary medications and months of side effects, what about the next test? Seniors often get it when they start to feel forgetful. But instead of answers, it can create panic, invasive follow-ups, and even risky brain procedures. Number 4, brain MRI for mild memory loss. It starts with something so common, so human, that most of us laugh it off at first. You misplace your keys. You forget a name. You walk into a room and can't remember why. But for seniors over 70, these little lapses often spark a deep, private fear. Is this the beginning of dementia? That fear is powerful, and it often sends people straight to their doctor. What happens next? More often than not, the doctor orders a brain MRI. On paper, it makes sense. An MRI is a detailed scan of the brain designed to show changes in structure, shrinkage, spots, or abnormalities that might explain memory loss. Seniors are told it's the responsible thing to do, that it will give answers. But here's the uncomfortable truth. In most people over 70, brain MRIs don't give clarity. They create confusion. Why? Because almost every brain MRI at this age shows something. White matter changes, tiny spots, a little shrinkage. And here's the kicker. These findings are usually normal signs of aging. They don't necessarily mean dementia, Alzheimer's, or anything dangerous. But once they're on paper, once a doctor looks at them and says, we see something here, the damage is done. Instead of reassurance, seniors often feel panic. That panic leads to more tests, spinal taps, blood work, sometimes even brain biopsies, procedures that are invasive, painful, and risky, all triggered by a scan that was never truly needed in the first place. Let me give you an example. Let me give you an example. George, a 74-year-old retired engineer, was sharp, funny, and active. But he started noticing he was misplacing his glasses more often and forgetting names at church. His family worried, so his doctor ordered a brain MRI. The scan showed white matter changes, something completely normal in older adults. But to George, that result felt like a death sentence. He panicked. He stopped driving. He stopped socializing. He convinced himself dementia had begun. Within months, his anxiety had taken a bigger toll on his memory than aging ever had. When we reassessed George with a simple cognitive screening test, a paper-based exam that evaluates memory and attention, his score was completely normal for his age. His brain MRI findings weren't dangerous at all. They were just age-appropriate changes. This isn't just George's story. A 2021 study in Neurology Today reviewed over 3,000 MRIs in people aged 70 to 85 who had mild memory complaints. The results? 86% showed abnormalities, but only 3% were linked to a treatable condition. That means almost everyone left the scanner worried about something that didn't matter. Worse, nearly 12% were pushed into invasive procedures based on vague scan results. Procedures that did nothing to improve memory and sometimes made things worse. So what's the safer alternative? If you're experiencing mild forgetfulness, the best first step isn't an MRI. It's a cognitive screening test. These are simple, quick paper tests done in the doctor's office. They evaluate how well your brain is working in real life, memory, attention, and problem solving, rather than focusing on harmless spots on a scan. Other powerful lifestyle tools often work better than any test. Proper sleep, staying hydrated, daily physical activity, brain-challenging hobbies like reading, puzzles, or music, social connections that keep the mind active and reduce anxiety. These do more for real-world memory than staring at shadows on an MRI ever could. Because here's the truth. A brain scan can't always tell you who you are or what your memory is capable of, but it can create fear that changes how you live. And for many seniors, that fear does far more damage than a few forgotten names ever will. So the next time memory slips make you nervous, pause before rushing into a brain MRI. Ask your doctor, will this scan really change my treatment? Or are there safer ways to check my memory first? Because sometimes the real danger isn't memory loss. It's the unnecessary medical cascade a simple scan can unleash. And if a harmless-looking brain scan can set off that much fear, imagine what happens with heart tests. Our next one is one of the most common and one of the most misleading. Number 3, cardiac stress. Test for decades, the cardiac stress test has been seen as the gold standard for checking heart health. Doctors recommend it when seniors mention fatigue, chest tightness, or just not feeling like they used to. The test sounds logical. You walk on a treadmill while hooked to monitors, or you're given medication that makes your heart beat faster, simulating exercise. The idea is simple. If your heart struggles under stress, it could mean blocked arteries. But here's the shocking truth. After age 70, stress tests are often more misleading than life-saving. Why? Because in seniors, the accuracy drops dramatically. Studies show that false positives, results that say there's a problem when there really isn't, can occur in up to 40% of adults over 70. Think about that. Nearly half the time, the test raises a red flag that doesn't actually exist. And what happens when a stress test raises suspicion? Seniors are often sent for follow-up procedures, angiograms, stent placements, or even bypass surgery. These are major interventions with risks of bleeding, kidney damage from contrast dyes, infections, and long hospital stays. Let me tell you about Raymond. Raymond was a 75-year-old retired postman. He stayed active by walking several miles a day, but noticed he got tired on steep hills. His doctor, worried it might be his heart, ordered a stress test. The results came back unclear, not normal, but not conclusive. Out of caution, the doctor sent him for a catheterization, where a tube is inserted into the arteries to look for blockages. A mild narrowing was found. The cardiologist placed a stent, just to be safe. That night, Raymond had a severe reaction to the contrast dye. His kidneys struggled, and he spent 6 days in the hospital. The irony? His fatigue never changed because it wasn't his heart at all. He was simply dehydrated and needed better rest between meals. Instead, he went through a dangerous procedure that left him weaker than before. And Raymond isn't alone. A major 2017 study in JAMA cardiology found that more than half of all stents placed after stress test referrals were unnecessary. These patients had no improvement in survival or quality of life compared to those who skipped the procedure. But they did face higher risks of complications, from bleeding to kidney injury. So what should seniors do instead? If you're over 70 and not experiencing classic cardiac symptoms, like true chest pain during exertion, shortness of breath on light activity, or sudden fainting spells, a stress test may do more harm than good. Safer alternatives exist. A resting EKG can check your heart's rhythm without stress. A coronary calcium scan, a simple low radiation test, can show whether dangerous plaque is actually building up in your arteries. And lifestyle measures, like staying active, eating a heart-healthy diet, and controlling blood pressure, have been proven to reduce heart risk more effectively than a treadmill test ever could. Because here's the uncomfortable reality. The stress test often turns healthy seniors into patients. It takes a mild complaint and turns it into a cascade of procedures that may end in surgery that never needed to happen. So before agreeing to a cardiac stress test, ask your doctor, what are we looking for? What happens if it's abnormal? Will this test really change my treatment? If the answer leads down a path of risky interventions for vague symptoms, it may be time to pause. Because in medicine, sometimes less is more, especially after 70. And if a treadmill test can so easily push seniors towards surgeries they don't need, wait until you hear about the next one. It's one of the most common cancer screenings in America, but after 70, it carries more risks than benefits. Number 2, colonoscopy, routine screening. When it comes to cancer prevention, few tests are as famous as the colonoscopy. For decades, it's been promoted as the gold standard for catching colon cancer early. Doctors recommend it at age 50, then every 5 to 10 years, sometimes even more often if there's family history or risk factors. But here's the hidden truth. After age 70, and especially beyond 75, a routine colonoscopy can become more dangerous than protective. Why? Because the risks of the procedure rise sharply with age, while the benefits decline. The preparation alone is a challenge. Seniors are told to drink powerful laxatives that flush the colon clean, but that flush can cause severe dehydration, dizziness, kidney strain, or dangerous shifts in electrolytes. For someone in their 70s, that prep can feel like a marathon on its own. Then comes sedation. Most colonoscopies require anesthesia, drugs that make you drowsy and block pain. But older brains don't always handle sedation well. Even a short dose can trigger confusion, delirium, or long-lasting memory problems. And finally, the procedure itself. While generally safe in younger adults, colonoscopy in seniors carries higher risks of bleeding, tearing of the bowel, infection, and heart rhythm disturbances during sedation. Let me tell you about Dana. Dana was 73, a grandmother who helped run a small bakery with her daughter. She was active, healthy, and had no digestive symptoms. No bleeding, no pain, no changes in her stool. She had already had 2 normal colonoscopies in the past, but her new doctor, eager to be thorough, urged her to schedule another. During the procedure, a tiny polyp was removed. Dana went home feeling fine, but that night she collapsed in pain. At the hospital, doctors discovered her bowel had perforated, torn during the colonoscopy. She spent 9 days recovering, lost 10 pounds, and never regained the same strength. The heartbreaking part? Dana's colonoscopy was never necessary. She was low risk, symptom-free, and past the age where new colon cancers are likely to be caught early by routine screening. And Dana's story is not rare. A 2019 study in JAMA Internal Medicine followed more than 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies performed in people over 75, only 2 lives were saved, but more than 20 seniors suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. Even when polyps are found, they're often small, slow-growing, and unlikely to become dangerous during a senior's lifetime. Removing them sometimes does more harm than leaving them alone. So what's the safer path? Experts, including the U.S. Preventive Services Task Force, now recommend stopping routine colon cancer screening at age 75 for most people. Instead, safer, less invasive tests are available. The FIT test, fecal immunochemical test, for example, is a simple at-home stool test that detects hidden blood in the stool, a common early sign of colon cancer. No sedation, no prep, no risk of tearing or bleeding. For seniors in good health who still want reassurance, these stool-based tests are often enough to catch real problems without exposing the body to unnecessary danger. So before scheduling a colonoscopy past 70, ask your doctor, do I have symptoms that really require this? What will this test change about my care? Are there safer alternatives like the FIT test? Because sometimes the bravest choice isn't saying yes to another invasive test, it's saying no when the risks outweigh the benefits. Now, if a colonoscopy, the test we've been told is essential for decades, can turn into a riskier procedure than most seniors realize, wait until you hear about the next one. It's marketed as the ultimate preventive tool, a scan that checks everything at once. But the truth? It may be one of the most dangerous tests seniors ever agree to. Number 1, full-body CT scans. It sounds like the ultimate peace of mind, a single test that looks at everything, your brain, chest, abdomen, and bones. The full-body CT scan is often marketed as the all-in-one checkup, especially in private clinics or so-called executive health packages. The pitch is simple. Catch disease early, stay one step ahead, and live longer. But here's the shocking truth. For seniors, full-body CT scans can do more harm than good, and in some cases, even cause the very disease they claim to prevent. Here's why. A CT scan uses ionizing radiation, a powerful energy that creates detailed images of your internal organs. But unlike an X-ray, which delivers a small dose, a full-body CT scan exposes you to massive radiation levels. Each scan equals hundreds of chest X-rays in a single sitting. In fact, one scan delivers 10 to 20 millisieverts of radiation, enough to measurably increase cancer risk. A 2023 study published in JAMA Internal Medicine estimated that CT scans may now account for up to 5% of all cancer cases in the United States. To put that in perspective, that's on par with the cancer risk from daily alcohol consumption. That means 1 in 20 cancers could be linked directly to a medical test that was supposed to save lives. But radiation is only half the problem. The other danger is what these scans find. The human body changes with age. It's normal to develop harmless nodules in the lungs, cysts in the kidneys, or calcifications in blood vessels. Most of these are completely benign. But once a full-body CT scan detects them, the medical system goes into overdrive. More scans, more biopsies, more surgeries. Each step comes with risk, pain, and fear, often for findings that never would have harmed you in the first place. Let me give you a real story. Marcus, an active 80-year-old who had taught martial arts to seniors, felt fantastic. As part of a senior elite health checkup, he agreed to a full-body CT scan at a private clinic. The scan showed a tiny lung nodule, just 3 millimeters across, harmless by all medical standards. But the moment it appeared on the report, the panic began. Marcus was referred to an oncologist. He was sent for a PET scan, then scheduled for a needle biopsy. The result? Completely benign. But during the biopsy, his lung collapsed, a complication of the procedure. He was hospitalized, weakened, and spent 2 months recovering, all for something that never needed to be touched. That's the cruel irony of full-body CT scans. They turn healthy seniors into patients. They uncover harmless, incidental findings that lead to invasive procedures that can cause lasting harm. And here's the kicker. There's no scientific evidence that full-body CT scans extend life in healthy, symptom-free seniors. The American College of Radiology has been clear. There is no proven benefit to routine full-body scanning, and the risks are substantial. So what should seniors do instead? The smarter, safer approach is targeted testing. If you have specific symptoms, unexplained weight loss, coughing up blood, persistent pain, then focused imaging can help. But scanning the entire body with no clear reason is like digging for treasure with a landmine detector. You may find something, but the damage along the way could be devastating. Your body doesn't need more radiation. It needs smarter care. Regular checkups, open conversations with your doctor, lifestyle changes like exercise, healthy food, quality sleep, and stress management. These protect your health far more than lying inside a CT scanner ever will. So the next time someone offers you a full-body scan just to be safe, remember Marcus's story. Safety doesn't come from radiation and machines. It comes from balance, prevention, and living wisely. And that brings us to the end of our list. We've seen how bone scans, brain MRIs, stress tests, colonoscopies, and full-body CT scans, tests that sound helpful, can quietly become harmful after 70. But don't worry, we're not finished yet. Stick around for the conclusion, where we'll tie it all together with powerful takeaways and show you what to do instead to truly protect your health. So there you have it, the 5 medical tests seniors should rethink after 70. Tests that sound protective, even life-saving, but in reality often bring more harm than good. We've seen how a simple bone density scan can trap seniors into dangerous medications that cause more problems than they solve. A brain MRI can turn normal age changes into a false diagnosis, unleashing fear and invasive procedures. A cardiac stress test can send healthy seniors down a path of risky heart surgeries they didn't need. A routine colonoscopy can trigger bleeding, tearing, and sedation issues when the cancer risk is already low. And worst of all, a full-body CT scan can expose you to massive radiation, unnecessary follow-ups, and even increase your risk of cancer. Each of these tests was designed with good intentions. But after 70, the equation changes. The body becomes more vulnerable, the risks of procedures rise, and often the benefits shrink. That's the truth most seniors never hear in the clinic, but you've heard it now. Here's what matters most. Real prevention isn't about more tests. It's about smarter choices. It's about lifestyle, daily movement, nutritious foods, deep restorative sleep, staying socially connected and mentally active. These are the things proven by science to protect your brain, your heart, your bones, and your independence. And remember this, you are not powerless in the face of medicine. You can ask your doctor the most important question of all. What happens next if this test finds something? If the answer leads only to more procedures, more risks, or more fear, then it may be time to pause. Because your time, your energy, and your health are too valuable to spend on unnecessary tests. Now, I want to hear from you. Have you or someone you love ever gone through a medical test that turned out to do more harm than good? Did it leave you with side effects, fear, or regrets? Share your story in the comments, because when we share, we learn and we protect one another. And if this video opened your eyes, if it gave you a new perspective on your health, please hit the like button. It helps spread this message to more seniors who need it. Don't forget to subscribe and turn on notifications so you never miss the truth that could protect your independence. Stay wise, stay strong, and remember, sometimes the most powerful choice you can make for your health is to say no. Thank you for watching, and I'll see you in the next video.